and a very warm welcome to our attendees. Just a reminder to all of the attendees that IOPSA is inviting you to the Plumbing Industry Awards. That is the black tie event happening on the 28th of July, 2022 at the Royal Elephant Hotel and Conference Center at 6 p.m. So if you'd like to get in contact, please email marketing@iopsa.org and let them know if you're interested in joining that. Then the tips to continually prevent COVID-19 with the resurgence of a lot of sick people. We're not too sure what's going to happen in the future, but what we do want to do is continually prevent COVID-19. Now, we have had quite a few people getting sick in the past few weeks, especially with the holiday season that just passed, and many are coming back home feeling ill. So we hope that those of you who are ill now get better as soon as possible. Those who have been sick, we're glad that you are back and healthy again. And we're really looking forward to ensuring that we try and prevent this from becoming maybe another pandemic in the future. So please wash your hands, use sanitizer when you don't have water and soap available. Do not touch your eyes, nose, and mouth with unwashed hands. Adhere to your social distancing, obviously avoiding close contact with people who are sick. Cover your cough or sneeze with a flexed elbow or tissue, and also clean and disinfect frequently touched objects and surfaces. Now, currently, the statistics are still there for you to go and take a look at if you'd want to get yourself vaccinated. Again, this is your personal decision, so please make sure you've made that decision along with your employer as well. If you are an employer and your policy is to make it mandatory, please ensure that you do have the correct documentation in place for this. Now, coming up for the month of May, we are going to be looking at COID. That is our Toolbox Talk for this morning. What is COID and why do we need it? We're then going to be looking at welding, ladders, scaffolding, and ceilings throughout the rest of the month. But our safety thought for this week is to think positive, because an accident is only an attitude away. Now, we realize that many of us have health and safety systems in place, whether it's a basic health and safety file, whether it's a full management system, or even when it's a ISO management system that you have implemented. It all comes down to our attitude toward health and safety. If we feel that it's not necessary, well, then it's going to show in the way we carry out our health and safety program, and it's also going to show in our statistics when it comes down to actual incidents that are occurring. Now, many are not actually reporting these, they're not recording them. So when we get to many sites, we ask them what incidents and accidents have happened, and they say none. No incidents, no accidents. And that all sounds right, but it's a red flag to somebody like myself, because we know that there are always incidents and accidents. Now, it doesn't necessarily mean because you have an incident that you're doing something wrong. It just means that you've gone through the correct reporting procedure and you are recording what is actually happening. And this helps us to establish what is going wrong, where are the gaps, and where can we improve. But if something does go wrong and it is minor, there is a very big possibility that you stop something major from happening. So when we look at incident stats, we are not specifically looking at how many incidents you've had and then rate your risk accordingly. We're looking at what was the potential for risk, how did you minimize that, and how were you able to stop somebody from dying or potentially losing an arm, a leg, or becoming disabled. These types of injuries and incidents, if you can minimize that to near misses, first aid cases, this is really what you are trying to achieve. We are looking always at zero incidents. If that is what possible, we are looking for that, but not zero incidents when it's just not being reported. We're looking at factual zero incidents because we are actually preventing incidents and accidents from happening. But when incidents and accidents do occur, if somebody does get sick at work, if somebody does get injured at work, there is an insurance policy for you. And this comes through the three main insurance providers. That is your Department of Labor, FEM, which is the Federated Employers Mutual Assurance Company, as well as Rand Mutual Assurance, or RMA. Now, COID stands for Compensation for Occupational Injuries and Disease. So if you have an occupational injury or an occupational disease, in other words, anything that arises out of your employment, then there is a compensation fund for this. Now, your employer has to pay these annual fees in order to get a letter of good standing, either from Department of Labor, FEM, RMA, or which other company you are using. Most often, you're going to use the Department of Labor or the FEM companies. RMA is more for the specialists in mining, iron, steel, metals industry. So as a plumber, you're probably going to go with the Department of Labor. If you work in a different industry, then you have other options available. FEM covers a lot of various companies. So if you do fall within their industry, you can also go and get a letter of good standing for compensation through FEM. But compensation as such means that you can be compensated for something that goes wrong. Now, the way compensation works is no matter who is at fault, compensation will always pay out for medical expenses. So in other words, if you get injured or if you get sick, you at least have medical coverage. So that is from the start, from trauma or emergency, getting yourself to the hospital, getting your triage in, making sure that you are safely kept alive. From there, if there's any surgeries or anything like that, it will then also be covered because it's, again, an occupational injury or an occupational disease. From there, you get a recovery process, and that is determining whether you can get back safely to work again and work in a manner as if you were healthy again or if you were not injured anymore. And so that process of recovery is also sometimes compensated. The way it often works is the employer will pay and then claim back from compensation. Then there is the resumption period. Resumption meaning resuming work. In other words, that employee now comes back and he starts working again. If that employee is on light duty or on split duty, or perhaps he's not allowed to do the full scope of his works, but he's allowed to continue to work in a specific area or for specific duties, as we mentioned, like light work, then he will get compensated both from the employer and the Department of Labor. Again, it's the responsibility of the employer to claim that compensation back. But once you've put in that resumption report and said to the Department of Labor, that employee is now fine, he's healthy again, or he's fit again to continue to work, you no longer need to pay this compensation. Very important to do that, because if you do not do that and the Department of Labor continues to pay and they realize that you are just claiming money extra, this is a criminal offense and you could lose your company, even serve jail time. So please do not claim if it is not a legitimate claim from the Department of Labor. So that fund that is there helps employees get the medical treatment that they need initially, as well as through their whole recovery period. But it also assists later on. You see, when an employee has that recovery period and then perhaps has maybe some issues relating to that initial injury or that initial disease, they can then continue to go back. And that process obviously needs to be committed as well through the Department of Labor. So it's a bit of a work in order to log onto the DOL website, the CompEasy website, and process the claim and work with the doctors. But you do not need to be a specialist in insurance. You do not need to be a specialist in compensation to be able to understand how it works. So let us go through the very basics of COID and what you as an employer specifically must know when it comes to COID. And as an employee, what are your responsibilities towards COID? So the first thing is, who should have COID? Who should have a letter of good standing? Now, the very first thing is to say every single business, regardless of what industry you're in, you have to have a letter of good standing. That is because the Department of Labor requires all employees to be safeguarded at work, but also protected in the event of something going wrong. So it's not only when you're starting to work with power tools or working in hazardous areas. Even myself as a consultant, I might not work with tools and we work in offices. I still need to protect my employees because anything could go wrong. Yes, I pay a lot less on my compensation insurance because I don't have hazardous work. And the more hazardous it becomes, the more likely injuries and accidents will occur. And so it's no doubt that you're going to pay a lot more because of the industry that you are in. So it's important then to note down what industry you are in when it comes to registering for the Department of Labor's compensation, or even FEM or RMA. And so that fund is there then for every single employee. In other words, all employers must have it for their employees. It's also based on how many employees you have. So the industry is important, and then how many employees, so that they know should a certain percentage of employees be injured during this year, there's enough money in that fund to be able to cover medical expenses. So if a person, in this case, under a contract, is called a mandator, in the course of the purposes for their business, enters into any agreement. Any agreement means you sell services, you pay for services. That agreement is between yourself and a customer, a client, a contractor. All of these agreements mean that you are undertaking to do certain work. That is employment. And so we need to ensure that any of those tasks performed are not just done safely, but there is an insurance should something go wrong. Now, as a mandator, if a contractor fails to register or pay an assessment, then those employees of that contractor will be deemed as employees of the mandator. So that's very, very dangerous. That's why, as plumbers, when you get jobs, let's say, for instance, you get it at the bank requests a safety file from you. And one of the first documents they're going to ask you to give is a letter of good standing to prove that you are actually in good standing with a compensation commissioner. And once you've done that, then they ask you to sign an agreement between you two. This is often called a mandatory 37.2 agreement. That states that you are an employer in your own right and that you must look after your employees' health and safety. Not just having safety files on site, but in the event of something going wrong, having that letter of good standing, as well as the procedure to follow to give those employees good medical coverage should something happen. So it's very clear, no one is exempt from having a letter of good standing from one of the insurance companies. But what is it actually for? Now, we have mentioned this, but again, Workman's Compensation is a compulsory form of insurance providing wage replacement. So if you cannot afford to pay your employees, and we've seen this with the TERS fund, because COID obviously was going to be paying out for COVID-19 related illnesses as well, because it's an occupational disease. And so many people claimed and said, well, we were not able to pay our employees, or employees, we weren't able to earn a living because we were off with COVID. And there was that special TERS fund that was set up. Now, that fund was actually already there. It's the compensation fund. And that's there for other things like asbestos-related cancer. If you got ill because of an occupation, or if you got injured because of an occupation, you could have your wage replacement available. So your employer couldn't pay you. You as an employee could then claim from this. Now, this is not unemployment. Please remember, it's not an unemployment fund. That's separate to this. This is a compensation for being injured or becoming ill because of your occupation. So even though you are not working currently, you are still an employee of the company. You just are not allowed to go back to work until you are fit for duty. You can then claim in order to replace your wage, because you don't want to become a burden on your employer. And obviously employers cannot pay for employees that are not employed. And so this fund was actually a brilliant way that the government, the Compensation of Occupational Injuries and Disease Act that was designed by the Department of Labor, came into place to assist employers, to help them should something go wrong. So the aim of this act, which is the Act 130 of 1993, was providing for compensation to employees or even their dependents, especially in the case of death, disablement caused by occupational injuries and disease. So it had to have been sustained during employment, okay, because it's an compensation for occupational. So it doesn't mean that if you went away on the weekend and had an accident and something happened to you on the weekend because of your own issues, then you cannot claim from this compensation fund. Then you have life insurance. that assist you there or your own medical. This is anything that happened during work. So this fund was actually brilliantly designed. And the reason for that is every employer would pay. And if you never actually had any employees claim for it, that money could be used for an employee that did claim for it. Now you think to yourself, well, that doesn't make sense. I'm paying all this money. I'm not actually using it. So it's a waste. Well, let's think of one surgery for an employee who perhaps breaks their leg. So they fall off a ladder, they break their leg, they are rushed into a hospital, they get the emergency treatment done first, they get an overall inspection by a medical professional, then they go in to see a doctor, and then from a doctor they go into a surgeon, they have surgeries, they're in hospital for a couple of weeks, they have a cast on for 6 weeks, then they go back for physiotherapy to make sure that the leg is working again. Through all of this, would you say that it would cost more than 10,000 Rand for this person? Or you probably sitting there thinking, geez, Chris, 10,000 Rand is probably only the first day of getting inspected at the emergency room. 10,000 Rand won't even cover anything in terms of medical when we look at what actually is the cost of medical treatments. Surgeries, 200,000-300,000 Rand sometimes for surgeries. So if you take a look at the cost of one person breaking their leg, and then one plumber with, let's say, 10 employees paying 9,000, 15,000 Rand a year towards compensation for all his employees, you think to yourself, I'm paying 20,000 Rand a year. Well, that doesn't even get you into the door of a hospital for emergency. And you are paying that for 10 employees. Now, let's say one employee breaks their leg. You're looking at over 100, 200,000 Rands worth of medical treatment for that one employee. What if 2 employees fall? What if 3 employees fall? Can you see how the exponential growth of cost of medical aid will just keep moving? Well, that's just one plumbing company. So with all of us combined paying an annual fee, hopefully, in fact, it's even the Department of Labor's hope that you don't use it. We don't want you to use it, not so that they could keep it, because we don't want you to get injured. But if you do get injured, we obviously want you to have that available so that the accumulation of funds can help those guys get enough medical treatment. And obviously, if they are off work, to be able to claim for their wages that they might have lost. So what are the responsibilities as an employer, as an employee? First of all, employers, you have to, these are obligations, as you can see here. You must register with a compensation commissioner, and you must furnish them with your particulars of your company. That's directors' information, employees' information. It might not be as in-depth as your UIF claims, where it's ID documents and things like that, but you're going to be able to give them enough information to see what industry you're in, how many directors you have, how many employees you have, and then also what is the type of work that you're working. You must keep accurate records. Now, the 2 records that you must keep are claims, which is in the form of WCL forms, and then records of incidents and accidents, and that is in the form of an Annexure 1. Then you must furnish return of earnings, or ROE. Now, ROE, or your return of earnings, means the amount of money a director or an employee makes over this period of a 12-month year. So they will say, how much money have you made in 2021? You put in your annual return of earnings for a director, or all directors combined, and all employees combined. Then you project how much you will be paying for the next year. Once you've done those return of earnings, it will then calculate how many employees you have, what is their basic earnings, as well as what industry you're in, and then it will give you a figure in order to tell you, you need to pay 4,000 Rand, 10,000 Rand, 30,000 Rand. We just had a client now that I did last week that paid 40,000 Rand for the year, but he has 30 employees working in a butchery with sharp objects. So if you think about it, 30 people, 40,000 Rand for the year, that's 1,000 rand, if not a little bit more, 1,000 rand per person for the whole year. That's not per month, that's for the whole year. That's actually very reasonable when you look at the cost of, let's say, one person cutting their finger off in that butchery for that whole year. That 40 grand wouldn't go very far if you had to save that and then pay hospital fees. So yes, that fund is there for a reason, and it is very, very reasonable what we are paying for it. As an employee, what is your responsibility? Well, number one, you must notify your employer of any potentially dangerous act or condition. The reason why we encourage you to notify your employer, your supervisor, your manager, if something could go wrong. And notice what it says, it's not a current dangerous act or a current dangerous condition. It's a potentially dangerous act or condition. The reason why we are asking you to notify it is so we can prevent it from becoming something serious. Even though that insurance fund is there, why use it? We pay for life insurance. I pay for life insurance so that if I die, my family is cared for because they're going to lose my income. And that's, quite disastrous if you think of how much people pay when somebody dies. Bills for funerals, and then just the ongoing grief that that person might go through. So we have a life insurance that will pay out if I die. Well, why would I want to use it now? I'm sure my family would prefer to have me there compared to having the millions of life insurance that you might have put in place. So yes, just because there is an insurance doesn't mean we have to use it. So something more simple, your vehicle has insurance. We don't want to drive into somebody else. If we can avoid it, that's what we're trying to do. But you pay insurance every month, and sometimes you pay quite a bit of insurance. But when you need it, that's when you realize the actual value to it. You must also notify your employer of any work-related incident and accident. Now, notice it's not saying first aid cases, deaths. It's saying any work-related incident or accident. Even if there was a potential for something going wrong, speak up, let them know. Let's see what we can do to prevent it from happening. And you, as an employee, you must also keep records of incidents that occur and notify your employer of such. This could be from near misses to even Section 24, 25 incidents. Section 24 incidents, section of the Occupational Health and Safety Act. So those are any incidents and accidents that occur under Section 24 or illnesses that occur in Section 25, which currently includes COVID-19. So how do you then go about sorting out your COID? Well, hopefully all of you listening in today have got your letter of good standing. In fact, we just went through the month now where you had to put your return of earnings in, pay for your compensation, which maybe it gritted you a little bit because it was such a big amount that you had to pay for the year. But be glad that you did that, because now you can generate a new letter of good standing and you can move on with clear mind that your employees are covered. So if you register a company, you immediately register as a COID user. You must submit your return of earnings. This is done every single year. So it's the earnings of directors and employees. You pay that amount. You then download your letter of good standing. And if you need to use it, you then please make sure you have registered now with Coetzee. So don't wait until an incident happens, because then the hospital is going to be hounding you for your claim number, or the hospital will just say you need to pay it and claim it back from the Department of Labor. You don't want to do that. It's a huge cost if you have to pay the hospital for claims now and then claim it back later. So register now on the Coetzee website. Get your company registered, get a user approved for your company. Make sure you follow those steps. We are going to have it in the Prime course where we take you through the step-by-step procedure to do this. We apologize that it's taking so long to get it to you. There have been some technical issues, but we are making sure that all of this training will be done step by step to assist you in the future. You're going to register a claim using one of the two documents, a WCL1, so it's the Workman's Compensation logs. One is for illness and two is for injuries. Then Keep your annual returns updated. When it comes to April, you have to submit new returnings every year. Make sure you pay it within that 30-day period and keep your employees protected. Again, don't rely on the insurance. Take care of your own health and safety while at work. Don't rely on this COID letter of good standing. Look out for your health and safety as well as the health and safety of others that are working with you on site. Keep your workplace clean. Make sure housekeeping is done regularly. A lot of incidents and accidents can be avoided just because of good housekeeping. Prevent accidents by preparing for the task and assessing the risk. Even if you need to get into the method of doing daily safe task instructions, a little DSTI. You might not be in construction, but remember, it's the attitude toward health and safety. Even though you don't have to do it according to law, maybe it's a good idea to start implementing it just for your own protection in a company. Prevent accidents by preparing for the task and assessing the risk. Work as a team. Resolve issues and focus on the task. Nobody wants to be in a divided workplace where you're fighting. It really doesn't benefit anybody. So work as a team, help each other. We're not telling you to speak out of turn, but at the same time, if you see something, say something. Then do internal audits. Don't wait for your client to come and check on your safety management system. Do your own internal audit. Go in and check, is everything being done according to how it should be? Adjust when necessary, and then get employees involved. There is nothing better than upskilling your employees in health and safety. Put them on courses. Let's get them onto Prime as soon as possible. Let's get them to understand what health and safety means. Who knows? Maybe they become the future safety officers in plumbing as well. So we want to say thank you very much for joining us this morning. Our safety thought again for this week: think positive. An accident is only an attitude away. Next week, we're looking at welding, the dangers of hot works and the different types of welding. We're going to be looking at the butt welding that the guys are using and why we deem this as a hot work on a site. So thank you very much. We look forward to seeing you next week. Stay safe.